Jolien Veldwijk is the Palestinian Country Director for Care and joins me now from Amman. Thank you for your time. It really is devastating that Gazan women and girls are having to suffer the indignity of this after the loss of so much. And what we saw there from that mother of six, Hadia Nasser, is she was being forced to improvise with scraps of clothing for her daughter who, has her period. What's the danger of that and the long-term health problems that can come from a lack of sanitary supplies?
Of course, the danger is additional diseases that these women and girls are facing. What we also see in our health clinic is of course that malnutrition also plays a really big role because it makes women and girls more vulnerable to these diseases. I've had girls tell me, that they're trying to find even diapers. They cut them into small pieces to use as sanitary pads. It's old scraps of cloth. Then of course there's also the issue there's no clean water, and sometimes the water trucks that come to communities, they can only come maybe once a week, and then there's just extreme water scarcity as well. There's lack of toilets. Some of the women have told us that they have dug like a hole in the ground where they have their tent. So the situation is extremely dire, and on top of that there's of course the malnutrition as well.
You have, I believe, stocks and supplies of sanitary and hygiene supplies ready to go on the border. What reason is Israel giving for not allowing that type of aid into the enclave?
It is really interesting. The reason that they're giving is that they don't call these necessary. So at the moment, they've only pre-positioned food. But even for INGOs, there's many of us who have so many supplies at the border waiting to come in. We have an active registration in Israel, but we are not allowed to bring these aid in because they tell us we are not registered and therefore we are not authorized to bring aid into Gaza.
What has really struck me from the video we just played as well is that there's an obvious embarrassment here for women. We know Gaza is a deeply conservative society, but the war has really shattered for them all the sort of social structures that they were used to. How is that lack of privacy and what they're experiencing with not finding any private space? How is that stripping away the basic human rights for women?
It is really difficult. What they're also telling us is, especially even when you have period pains, you need to sit sometimes and let the cramps, pass, but you can't sit. There's no quiet space to sit. Normally you would maybe do that in the toilet, but if there is no toilet, if you share your toilet with many other people who also live in tents, people may just come in. There are not always locks on the toilet doors, if there even is a door. Sometimes what we've seen also when I was in Gaza, people have hung up sort of tarpaulins to create that sense of privacy, but it's way below the minimum standards, of course, and it's been really difficult and definitely also a big safety concern.
Yeah. Connected to this, of course, the difficulties for pregnant women and women giving birth as well. What conditions are you seeing that they're facing, and what have you been able to do to help?
So we have, out of all of the children and women, pregnant and breastfeeding women that we have screened for malnutrition in our own clinic in Deir Balach in Gaza, 13% of the children and 43% of the women screened suffer from either moderate or severe acute malnutrition. So you can imagine the list of what they need is so long. And whilst we are receiving, nutrition supplies and some medicine from UN agencies in our clinic, we have not been able to bring anything in since the start of the blockade on March the 2nd. So also we have baby kits, mama kits at the border, which also include sanitary pads, diapers, but none of that is available in Gaza now, and it's been really heartbreaking because also there's no transport available. So even for these women and children to reach the clinic, they have to walk. And I think what is really important to mention is that for an estimated 55,000 pregnant women, each missed meal increases the risk of miscarriages, stillbirths, and undernourished newborns.
55,000 pregnant women. I could not imagine the trauma of being pregnant in a war zone like this right now. But Jolien Veldwijk, we really truly appreciate everything you are doing with your organisation CARE. Thank you so much for joining us.
Thank you.